With Sequoia Health, bringing this week's Wednesday Wellness Minutes, and this week we're going to focus on peripheral neuropathy. One of our patients had asked us for more information about why people lose or have decreased sensation in their feet, what happens to cause that. They want to know what the causes of peripheral neuropathy are and things like that. We'll give you a brief overview as far as some background information. Basically, people come in here to figure out what the root cause of their peripheral neuropathy is. It could be a central neuropathy, but we help them understand what the cause is, whether it's a bug, a metabolic thing, or something else, maybe a structural issue. So just understanding that peripheral neuropathy is not just in the feet. People can have peripheral neuropathy in their hands. People can have peripheral neuropathy in their face. It just depends on what part of their body is breaking down. So some of the symptoms that you can have with peripheral neuropathy are tingling, numbness, they can feel heavy, you can start losing grasp strength, you can start losing control of your feet, so people can start stumbling, dropping things. Sharp stabbing pains can be very common with peripheral neuropathy. Some of the causes of peripheral neuropathy that you may or may not be aware of are metabolic. So you can think of things like diabetes mellitus or type 2 diabetes. Something like hypothyroidism. A lot of people suffer from hypothyroidism, but they don't understand why. That can cause peripheral neuropathy. You can do medications. Most people are unaware that a statin medication is one of the leading causes of peripheral neuropathy. So keep that in mind for people in your family. Physical trauma. Falling down, hurting part of your body, getting peripheral nerve entrapment. Like if I get an injury to my elbow here, it might cause a peripheral entrapment of a nerve, which would lead to neuropathy in my hand. Or someone might have a bug like Borrelia in their body, or something else like Bartonella, or something strep-wise, breaking down the disc in the low back, which would cause compression of the nerves, which would then lead to peripheral neuropathy in the lower body. It can start up here, it can start at the pancreas, it can start in the brain. Bugs can be eating on your myelin. It just depends on what your root cause is. So that's what our job is, to figure that out for you. Foods, there you go. Gluten is a huge contributor to peripheral neuropathy. You can look it up. There's even peer-reviewed research to collaborate and corroborate that fact that gluten can lead to peripheral neuropathy. So from a functional standpoint, we want to ask certain questions. We want to ask, is it peripheral or is it central? Is it central nervous system or is it peripheral entrapment or something else like that? Is it neurological in basis? Are the nerves damaged, or is it a metabolic issue like diabetes that's causing, for example, congestion in the lymph? So are nutrients getting down to the feet or out to the hands as well as they should be? Maybe it's thoracic outlet syndrome that's causing your peripheral neuropathy. It just depends. And then you have to ask, is it one of those two together, or is it maybe all four of them? Is it one of the three or three of the four? You don't know. That's our job to find that out for you. How do you prevent peripheral neuropathy? Because it doesn't have to be just because mom and dad had peripheral neuropathy or my cousin had it, then I get it. Your DNA is not your destiny, your DNA is your opportunity, so keep that in mind. You want to, of course, most importantly, keep a healthy liver. Keeping a healthy liver is going to help the lymphatic drainage that circulates your body to get out of your body through the liver and then through the digestive system. So that's important. Have a healthy liver to be able to detox toxins out and then have the lymph be able to flow. So exercise is a good way to do that. Exercise, jumping up and down, stepping, rebounding, walking. You don't have to jog or anything like that, but moving your physical body, because your muscles contract and they move the lymph back to the duct to get it out of your body. Balancing your blood sugar is huge. Diabetes is probably the leading cause of peripheral neuropathy, but it doesn't have to be, especially type 2 diabetes. That's completely reversible from a standpoint. You got to get the pancreas turned back on, get the liver detoxing, able to process all the insulin and the glycogen in your body, and making sure sugars aren't excess floating through the body. Balanced brain. If you have a lesion in the brain, let's say either from a microorganism or what we call in functional neurology a hemisphericity, where one side of the brain is overloaded, causing too much tension, if you will, in the other side of the body, that can cause, for example, internal rotated shoulder, external rotated hip. That can cause peripheral entrapments. Could compress the low back, causing disc issues, just depends. Balancing your structure. If you have a low back injury or something that's contributing to low back degeneration, you can then have that peripheral entrapment, or peripheral neuropathy rather, develop at the feet or outward if the problem's at the disc, in the neck, or in the low back, or somewhere else. It can be, you can have peripheral neuropathy on your abdomen where you have decreased sensation or changes in sensation, sharp stabbing, things like that, because of an issue in your mid-back. It just depends on where you're coming from. So let's think about, we mentioned the microbiome briefly, but there are all kinds of different bugs in our body. We have 750 to 100 trillion different microorganisms, whether it be mold, fungus, bacteria, parasite, or virus in our body, that can cause and contribute to some of these things. So we want to make sure that that brain is balanced from a neuroemotional standpoint as well as a microbiological standpoint. So these are just some ideas to help you understand a little bit more about where your peripheral or neuropathy, or someone else you know that their peripheral neuropathy is coming from. Feel free to shoot us any questions. Give us a thumbs up if you thought this was beneficial. Let us know if this is helping you, empower you to understand more about your or your friends' and family's health, so that we can make sure we're putting out good information that's going to help you feel stronger and live a better life. And send us messages. Let us know what topics you want to learn about. I'll be happy to expand on anything you're looking for, but I need to know what is of interest to you so that we can make it most beneficial for you. Hope you have enjoyed this, and we'll look forward to seeing you next week for the Wednesday Wellness Minute.